Okay, hi, pleasant good night to all, and thank you once again for joining us here on another Healthwise by the St. Kitts Nevis Medical and Dental Association. We are indeed grateful to have you with us every Monday as we bring awareness to the many sicknesses and diseases that plague us as a country, as a region, and internationally. Now, in the early 1600s, I was a teacher of history, so I want to give a little bit of history on our topic tonight. So in the early 1600s, St. Kitts became the first British colony. And then we quickly became known as Lyamega because of our rich, fertile lands. And by the mid-1600s, about 1643, St. Kitts became Britain's most prized possession in the Western Hemisphere. And all that came about because of the growth of the sugarcane. We became famous for our sugarcane. And this continued even after the fall of King Sugar in 2005. We still beat our chests and we say we are from Sugar City. And we try to incorporate this term sugar in everything we say and in everything we do. So we have sugar mass. We even have a sugar band who call its followers sugar heads. We have sugar cakes, and I can remember as a child that was a delicacy, especially on Sundays with peanuts. We have sugar travels, and we have sugar trains. However, it seems as if we are taking this sugar too far, because as a federation, we are seeing increasing numbers of diabetic persons who are suffering from too much sugar in his or her body, and the ills, the complications, the nightmares that come along with having too much sugar in the body. Here with me tonight is a group of persons attempting once again to curb this sugar problem. It is overwhelming. It is burdening the health system. It is burdening the economy on a whole. It is causing families to be stressed. And tonight, to help me dissect this problem, bring more awareness, because I have to be honest, we are out there, we are bringing the awareness. What is lacking now, I think, is action. So here with me tonight, I have a beautiful panel. And I'm going to start out to my first panelist on my left, one of the new faces of medicine, and we have Dr. Phipps, who is a general practitioner. And Dr. Phipps has joined us no more than a year and a half, 2 years. And we are so happy to have you here tonight. And thank you for volunteering, for taking time out from your family and your busy schedule to be here with us tonight. We have next to me on my immediate right, I have George Noland, and we know him as Brother Burnell, who is a diabetic patient. Unfortunately, as a surgeon, our paths crossed sometime earlier this year, I think it was. And to my further right, I have another famous person we all know here in St. Kitts, Nurse Keisha Bloice, who is the CEO of Kare Agency, and she's here to give the perspective from a nurse's point of view. So we're going to get straight into our topic, and the audience, once again, thank you for coming, thank you for viewing. And I also want to say thank you to my co-host, Dr. O'Loughlin, who comes out every other Monday to host the show as well. So we're going to get straight into our topic, and we're going to have Dr. Phipps start out by giving us a brief definition for what is diabetes. Okay, Dr. Phipps?
Okay, good night, everybody. Don't mind me, I'll be speaking very much in layman's terms tonight, because the aim of why I'm here, or the reason why I'm here, is not only to educate you, but also so that you understand and that it convinces you or compels you to have a change so that we have less and less cases of diabetes each year. So diabetes, basically, it's a chronic, meaning long-term health condition that develops because the body is not able to properly process from you eating food to you gaining energy. And that usually leads to a high amount of sugar in the blood, right? So basically, over a prolonged period of time, you have high glucose in your blood. So there are three main types that I'm going to shed light on tonight. There is type 1, usually that accounts for about 10 to 15% of the cases that we see. The onset is quite rapid, usually under 30 years of age, and the symptoms, they come out pretty fast. With this, the treatment absolutely is insulin. With the type 2 diabetics now, this accounts for about 85 to about 90% of the cases that we see. And with this one, you can actually have diabetes without getting the symptoms as quickly as with type 1 diabetes. And this one usually gets it around age 45, right? And this one is a slow onset, and it can be managed initially, whether by dietary changes, lifestyle changes, exercise, or you can actually start on some oral medication, or it could reach the point where you start taking insulin. I'm going to focus a lot on type 2 diabetes tonight, all right? Some of the risk factors that I like to shed a little bit of light on in terms of type 2 diabetics would be your age, as I mentioned before, obesity, whether you're getting really fat, especially around the tummy area, that helps. Genetic factors, family history, positive family history, whether your mom was a diabetic, your father was a diabetic, grandparents were diabetics, and stuff like that. Gestational diabetes, that's the third diabetes that I forgot to mention. That gestational diabetes usually develops when you're pregnant. Patients usually test for gestational diabetes around 24 to 28 weeks, so that's about 6 to 7 months. Yes, and so that is also a factor that would predispose you to getting diabetes later on. Or if you had a baby that was really huge, let's say about 9 pounds, usually that helps you to get, that predisposes you, to get diabetes later on in life. Hypertension, polycystic ovarian syndrome, all these different factors that take part.
Okay, Dr. Phipps, thank you so much. But you mentioned a few things there that caught my attention about the risk factors. You spoke about certain things that would make someone prone to becoming a diabetic. Can you just underline that for me? Because as my mother would say, we have to sometimes beat things over and over, say it over and over, so that people can understand. What are some of those risk factors you just mentioned? You mentioned about 1 or 2 of them, but just for the public to latch on, because sometimes you hear things and you don't hear it. So let me hear those. You gave some risk factors. Can I hear them again, please?
So your age, as you get older, it actually increases your chances of getting diabetes. Also, obesity. You're getting fat. You're getting fat, especially around your tummy area. If you realize you have a big tummy, you're one of the persons that have a higher risk of getting diabetes later on in life, right? There's also the fact that if you have a positive family history, let's say your mom or your dad was a diabetic, grandparents, aunts, it may be down the line for you. That's why we're doing this program, so that we could shed a little bit of light so that you don't have to actually get there. You can do a lot of different things to try to prevent that or try to keep diabetes at bay, right?
Thank you so much. I'm going to bring in our diabetic patient because Brother Burnell and I, in fact, I didn't even know him as Brother Burnell. When I met him, he was Mr. George Noland. And our paths, I'm a general surgeon, and our paths crossed. And to this day, I am still much disturbed about our interaction, how that went down, in terms of what I had to do to help him or to save his life. And Brother Burnell is a diabetic patient. We met on the surgical ward. And I'm going to let Brother Burnell describe exactly what took place. He's going to also describe, his journey as a diabetic, the challenges he may have, because remember, when we are looking at diabetes, we are looking at the nightmares. I think we have moved away from all of the signs and symptoms, which are very important, but we are looking at the complications. So Brother Burnell, just shed some light for us in terms of when you were diagnosed with diabetes, why our paths had to cross in such an unfortunate manner. Brother Burnell.
All right, let me say good evening to our listening audience, our viewing audience, and I want to thank Dr. Woodley for affording me this opportunity, this privilege to come and share with us as the patient. And in my own layman term, as Dr. Woodley would have said, that it's over a year now. I think October of this year would have made a year since our path would have crossed. Fortunately, unfortunately, and I was admitted to the Joseph and France Hospital, and in a condition that Dr. Woodley would have described to me was really bad. I think I might not be able to exactly give you the figures, but I think Dr. Woodley said to me that the weight, what should I say, the proper measure, right, should be like 5 point.
5 point, in terms of your sugar?
Yeah, you
should be at least on the 5.5.
5 point, but when our path crossed, it was like 10 plus.
It was 10 plus, yes. It was 10 plus, and when we did it in the other figures, you were actually over 400.
Yes.
With your sugar, which means the level of sugar within your blood was so high that if I had gotten a little higher, who knows, you could have gone into a coma.
Okay.
And that's another complication, another nightmare of being a diabetic. So, as you said, you came in with very high blood sugars. Okay.
It was, blood sugar was very high, and I would like to say to us, as you view, and as you listen, and I share with you that, it's not a good thing to be diabetic, because as you could see, I had an amputation, and with conversation with Dr. Woodley, it was a strange occurrence to lose or to amputate a hand. But life, I want to say to us, life is not lost, Dr. Woodley would have done a great job for me, with me, and I'm trying now, coping to live with the condition. It is some challenges, but I want to say to us that life is not lost. It's not lost. You can make that turnaround by adjusting your diet, adjusting your exercise, and your total lifestyle should be changed if you want to live with it. You can live with it, you can fight it, you can win it, because as you can see, I'm living with amputation, and I'm doing pretty fine I'm doing for myself. I does certain house chores for myself. Still have the challenges, like I said, I lost the power hand, the right hand, but I'm living, and along with Dr. Woodley, and to my right, Nurse Bloice, would have done a wonderful job for me. They would have done a wonderful job, and I'm just trying to, continue to do the things that they would have implored on me to continue to do, to live with diabetes and live a healthy lifestyle.
Okay, thank you, Brother Burnell. And what I want to highlight here, and I'm going to ask you the question before I make my comment. How was the public? What was the reaction of the public when this occurred to you? Was it accepting? Was it rejection? What were the sentiments that you evoked when you went back into society with your right arm now amputated?
I had mixed reaction, but in most cases, it was acceptance, and folks was willing to work along with me, do things that, like I said, I immediately could not have done for myself. Mm-hmm. I had like a 3 months layoff, and then I actually went back to work. Yes, I'm working.
Mm-hmm. That's good.
I'm working, and folks, they accept it, and I try to share, because I am actually a host of a radio program, and I encourage folks that life in itself is not lost because you're diabetic, but with that change, you can live a healthier life.
Okay. And that is something I want to highlight, that Brother Burnell has gone back out to work. And Brother Burnell has been one of the fortunate ones who were accepted after this procedure took place.
Yes.
But I know of many persons who are afraid to go back to work because of the stigma that is attached to having an amputation. And in so doing, they stay at home. Having or being an amputee does not mean you cannot work. You have to remember that you still have to contribute to your pension down the line. So you need to go back out and work. Because the longer you stay at home, that's less money you are putting into your pension scheme at Social Security, and the less money you will get. So I want to applaud Brother Burnell for not succumbing to the depression and the bad feeling of what he went through. And I can only empathize because I can't imagine what it would be to lose your hand, your forearm, and in Brother Burnell's case, his arm. And that was his power hand, as he said, that was his right hand. That's the hand he uses to write. That's the hand he uses for everything. So Brother Burnell, next question. So how you make out? How you button up your shirt? What? I'm curious.
I would have done some innovations, right? Putting on my shirt, I actually have somebody that would button it for me, but I put it over, right? Pants, the same thing. But, you know, like I said, the things that I cannot or I have not already grasped in my condition, there are folks that is around me that help me with it. But generally speaking, I still go into the kitchen. I'm into the kitchen. I, do house chores. I wash using the feet. Would say like your feet now becomes your hand, and so you like I said, you find innovative ways. And like I would have said to so many people that if I am going to cry, if I'm going to go into depression and just take myself away from the public and things like that, I mean, it just wouldn't work. The hand wouldn't cut back. Your hand wouldn't come back. Right. If I do all of these things and the hand come back, then I'll do it every day, Dr. Woodley. but and so I think I'm speaking to somebody who really need to be encouraged that life as a diabetic or life with amputation, in my case, like Dr. Woodley would have said, most amputation is the feet. But with the hands, I mean, now you have to find ways in doing things. And so once you determine, which I am, I determined in myself that I'm not going to sit down. Folks ask me if you go to town. Yes, I do. Yes, I do. I go to the banks. I go to the supermarket. I live a normal life. And I want to say to us out there, if I'm speaking to somebody tonight that might have had an amputation of the arm like me, or even an amputation of the feet, that you can live life. You can live life. I mean, I turn it around because some folks will say, Dr. Woodley, it's disabled. But I found a new word, and I use differently able. Right? Differently, in that you find, okay, I can wash, but I have to find somewhere for doing my washing, so I do it differently, Yes, so another thing that I have to do, I mean, if I'm lotion in my hands, I have to use the legs. I have to put the lotion on the leg and then you use it. You just find ways of doing it, and life goes on, and I want to encourage us that life goes on in spite of.
Brother Burnell, you have inspired me. I actually, before coming here, after our interaction, I was so depressed about what happened. And, I was wondering how I would be now. I'm seeing you back again since it has been a year,
yes.
now. And sometimes what I think the diabetic patient doesn't understand, that it takes a toll on us, the healthcare workers, that we are treating you, because as Brother Burnell would know, we didn't go straight to amputation.
No.
He had been to the OR a few times before, where I was trying to save the limb. We would do what we call debridement, remove the dead tissue, And we did about we made 2 or 3 attempts. And then eventually, which was very sad for me, we lost the battle. And it was really depressing when I had to go back and say to him, okay, we have to take the arm to save your life. And it happened really fast. It was, as I was saying, the nurses who worked with me, they were equally depressed, saddened by what was taking place. And sometimes I think the public actually separates us, the healthcare workers, emotionally from the patient. And I'm here to say that's not the case. We get attached. We get very much attached to the patients we are taking care of. So when these things happen, we are affected as well. As I keep saying to my colleagues, I sometimes think that we need to get some type of counseling sometimes, because this is trauma, emotional trauma for us on a daily basis. And sometimes no one, think about it or even think it is necessary for us to be treated psychologically for all of these things. So let me see the slide, which is slide number 10, with too much sugar. And that slide has shown one of the complications of diabetes, which is amputations. And what Brother Burnell has taught me, that we normally focus on the foot. We normally focus on the toes, the foot, the leg, the thigh, but we sometimes forget about the upper leg. We have blood vessels up there as well. If you look at the red side of the gentleman, where he's not clothed, we see the ills and the nightmares of being a diabetic, the complications. Let me underscore here that by the time you begin to get complications, you would have been a diabetic for more than 5 years, 2, 3, 4, 5 years, up to 10 years. And the things we see are stroke, blindness, heart attacks, kidney failure, which is another NCD that is rising here in St. Kitts, impotence, that's very, very important. Impotence, and of course we have our amputations. So we are now going to slide a little further across the table to our lovely nurse, Nurse Bloice. And Nurse Bloice, explain to us your role as a nurse in taking care of diabetic patients, what we can do to help them cope, what we can do to prevent patients from reaching to this point. Nurse Bloice.
Hi, good evening, everyone. Well, for me, as the patients are passed on, we have to first look at them holistically, not just as a diabetic, because there are many ailments that comes with diabetes, and we have to look at the person as a whole. And for me as a healthcare provider, my role begins sometimes even before the patient meets the doctor. But if after meeting doctor and you're on the unit now, on the ward, and you have a situation where we have somebody who comes in who is septic, meaning that the infection has been spreading in the bloodstream, we are saying it's danger zone at this point. And sometimes, like Dr. Woodley said, the general public is not aware that we have emotions. Even though we don't know these patients personally, they become like family. And because we listen to them, because that's our role too. We are providers, we are mothers, we are nurses, in the sense that we nurse people back to wellness. We begin with nursing them, listening. And sometimes the stories you hear, you realize why they got to that point. And so for me personally, I try and make sure that some of the complications that I see that are in front of me at the time, I look at the person and think about what they are concerned about, because a lot of times it's the diet, what we put in our mouths matter. And as this series is dubbed, The Nightmares of Sugar, it's so important at this point, because this is a pandemic to me in itself. We have a lot of diabetics walking around and they don't know they are diabetics until, unfortunately, they have a car accident or some other trauma brings them to the A&E department, and in just simply doing a simple test where we have a glucose reading, that's when they know their sugar levels is high sky, the machine can't read it, and then we know when we do that blood test, it's horrible, and then maybe a week after the HbA1c comes back in the 17% mark. I mean, this is critical at this point, but nonetheless, it's not too late. So nursing people with diabetes, we have to look at them holistically first. Their lifestyle plays a role, because even we treat in hospital, when they leave, they continue with the same lifestyle, and then they keep coming back. So you'll continuously see the same persons. So you're beginning to wonder, is education really working? Is awareness really taking place? And I think to some extent that some persons, they don't really understand what diabetes is all about and the complications. They think, okay, it's just taking a little tablet or a little insulin, and they take it when they feel like and don't have it when they care for, and they eat what they want, forgetting the pot. We moved away from the pot for a while now with the fancy things that are happening with us, or little saying kids are becoming so modernized and technology is taking over. We are now resorting to meals that are quick fix for the family that are busy. So we're not eating from the pot anymore, and that means we're introducing more sugars. And the sodas and all those fuzzy fancy drinks, we're giving them to the children. So it starts in the home really, and it starts with the children. What we feed them, we are also eating from the pot. So even though as an older person, a mommy in the house is diabetic and the daddy or the grandfather, we're now beginning to see the children with diabetes as well, because they are all eating from the same, sorry, not pot, but from the same fast food restaurants. So treating everyone should start with the holistic care from the psychosocial aspect, because their lifestyle matters, so that we can have a change in behavior, so that going forward, even when they leave our facilities, they still understand what's happening, so they can actually make decisions that are better and healthier for the family generally. And that's where I think that we have a deficit, and we need to address the telling, actually breaking it down. What happens? You're gonna get blind if you continue on this path. Yes, you're gonna get kidney failure. You're gonna need dialysis, and only maybe a lifespan of 2 to 3 years if you could afford each visit, because it has a cost. We have to scare them now. It's a real nightmare scare people if it's really bad. And I think we're at this point where we have to really be scaring people, because treating the person in the bed is not just a diabetic. They have other complications again. Hypertension is with that. They might have cancer along with that. Other issues are happening in their family and their dynamics. So you're treating the whole being, the person on a whole. So for me personally as a nurse, seeing these patients every day, and this is every day, it means that we are not doing enough. We are not doing enough.
Okay, thank you so much, Nurse Bloice. You mentioned treating the patient as a whole, and I do agree with you. We have to start with the mind. We have to then start with the soul, and then we treat, the physical aspect of the person, the body. Okay? Dr. Phipps, what, in your opinion, you are just coming back from studying, how do you see yourself going forward and being a positive influence or contributing to curbing this diabetic pandemic, as Nurse Bloice so eloquently put it? It's actually a pandemic for true, because it is not just in the Caribbean, it is worldwide. So as a young doctor, let me hear from you. What do you think your role is and how you can have a positive impact? Okay?
Well, to be honest, having studied in Cuba, many of the patients that I dealt with, they were very much well aware of their different diseases and stuff like that. They knew what it was about, they knew their medication, they knew the complications, and they tried to abide accordingly. I came back to St. Kitts, and it was not that way. It wasn't so at all. I found that a lot of the patients, they don't really know what the disease is about. They just know, oh, take this medication. Oh, I have to take my insulin. They feel as if after being diagnosed with diabetes, their life continues as it was before, when it actually isn't so. There needs to be a significant change completely. A lifestyle, it needs to change completely. So what I try to do, regardless of the ward that I'm on, I try to start with preventative measures, because even if you don't have diabetes, I still give you the same talk. I still give you because I don't want it to get to a point where you do have diabetes now and then we're dealing with this. prevention is better than cure. That's my mantra. That's what I love to say. I love to tell my patients this, and this is what I live by. So even if you don't have it, or even if you do, I try to explain to them what it is actually and the different complications that happens because of it, and what actually is happening behind the curtains. Because I feel sometimes we use a lot of fancy terms, and then the patients get really confused and lost in the jargon, but I try to simplify it for them very, very, very much. So after having done that, I go more so to the treatment, or the preventative measures rather, and I start a lot with dieting. I try to live by it, so I try to preach it to my patients. I'm not the best. I think I'm a little bit of a hypocrite with that, but I try to live by this. If you can plant it, you can eat it. If it comes from an animal, try to stay far. I like to say that because everything that you can plant, your greens, your vegetables, your fruits and stuff like that, you can have a lot of these, obviously in moderation. But with the meat, the red meat, the beef, the pork, the mutton, the chicken in excess, I feel like sometimes we go too much, we go too hard on these things. I take, for example, our Sunday meal. What do we eat on Sundays? We have rice and peas, we have a macaroni pie, we have potato salad, scallop potato, we have a corn on the side, we have the fried plantain, and we have the turkey, we have the chicken, we have the fish. And you know what we have for vegetables? Some coleslaw with a lot of mayonnaise. Like it just defeats the purpose. What are we doing? You understand? So I think it needs to start there. Like half of our plate needs to be filled with vegetables, filled with greens. You understand? I feel people don't eat fruits anymore. And when they do eat a fruit, they want an applause for it.
Yes.
This is what it's supposed to be. You understand? So I start a lot with diet. Lots of greens, lots of vegetables, things that come from the ground, you're good. Thumbs up. I also start with exercise. I myself, I exercise quite a lot, and I do that because I didn't want to be a hypocrite myself. I didn't want to be preaching to my patients saying, you know, you should exercise, you should this, and I'm home sitting down on the couch. It makes no sense. I have to live or lead by example. Right? So exercise. Even if you have a really, really busy schedule, a little 20 minutes every day, a little 30 minutes, just walk around the track instead of driving to go down the shop down the road, because sometimes we get a little bit lazy sometimes, and you know the time, and so just wherever you can do it, try as much as possible to do it, because to be honest, you may think that, oh, I don't have the time now or whatever, but then when the time that you're thinking that you don't have now, you're going to think that you're going to have it later on. It makes no sense. Don't wait until you have diabetes to try to cure it or to try to control it. Let's try to prevent it. You understand? So that's what I live by. I live by diet, I live by exercise. That's what I try to preach to my patients.
Amen, Dr. Phipps. That was good. That was impressive. So we're going to stick a pin there, and we're going to go and pay some bills. And you said something very interesting when you compared Cuba to here in St. Kitts. And when we get back, I'm going to go a little more into that. So we're going to have a break, and we'll be right back.
Your National Bank Visa debit card 5 times or more weekly for a chance to win a $500 shopping spree. Compliments of National Bank. So think twice the next time you want to use cash. Choose your National Bank Visa debit card instead, because you might be the next lucky winner.
What's going on?
Tony Frederick!
You've just won National Bank's cashless SKN $500 weekly shopping sweepstakes.
Use your National Bank Visa debit card every transaction for a chance to be the next lucky winner.
I've just never won anything before in my life.
Cashless SKN is our new lifestyle choice. National Bank, always here. Always here.
Dr. Blake's General Dentistry and Orthodontics, located on South Independence Square Street in Basseterre, is the place to discover that perfect smile you have always dreamt of. With convenient hours to serve you, Dr. Blake's Dental assures the best preventative and restorative care to guarantee the health and beauty of your smile. Call 466-7622 for your appointments.
Okay, pleasant good night once again. And if you're just joining us, we are discussing the nightmares of sugar in Sugar City. And so far, we have had a very interesting discussion with one of my patients, or our patients, Brother Burnell, who unfortunately suffered an amputation of his up to his right arm. And I'm here with Dr. Phipps, one of the new faces of medicine in St. Kitts, who is giving her perspective and how you should take preventative measures to prevent becoming a diabetic. And I have Nurse Bloice, Keisha Bloice, Wallins Bloice with us, who is giving her perspective as a nurse. Now, before we went on break, Dr. Phipps said something very interesting, that when she studied in Cuba, which is the place I studied as well, the patients understood and they knew about the disease process, what they had. And I have to concur with Dr. Phipps as well. When I came back home, that was something surprising to me, because most persons didn't understand what type of disease they had. And I do believe once you understand what you have, you'll be better able to comply with your medication. You'll understand what are the complications, hence you will try to do measures to avoid such. So that's a very interesting observation that Dr. Phipps came about with, that myself, I understood when I got back home as well. I want to show the charts, that's number 3, where we have a table showing the diabetic cases that we have on the island from at least 2015. As we see, the numbers are rising, and these are just registered persons. These are the persons that show up to the health center and are registered. I don't think this is taken into account those who we see at the private institutions and those who are diabetics and are not registered. And if you realize we have a steady increase, it somewhat decreased in 2018 and 19, but it is still there, plateaued. What the International Diabetic Federation has said, when you see these numbers, the registered numbers, to get the true value, you sometimes have to multiply by 4. So we have an idea as to what is going on in our country. Yes, I know we are the country of sugar, we are Sugar City, but I prefer us not to have the sugar within our body. Let us be sweet in the way we interact with each other. Let us be sweet with the nice things we do for each other, not by having so much sugar within our body. It serves us no good. Okay? So, Nurse Bloice, when it comes to taking care of the foot, because this is where most of our problems lie. Taking care of the foot. I always say persons think when they go to the bath and when the water runs down on his or her foot, that is actually foot care, and that's taking care of your foot. And I normally say, no, that is not. That is not taking care of your foot. We make up our faces, we get our nails nicely cut, we put on the best clothes, and then sometimes when our eyes drop a little lower and we look at the feet, you know, our mouths open because we are wondering what is happening below there. Taking care of your foot as a diabetic is super, super important, because when you take care of your feet properly, it prevents you from going on to get an amputation. It prevents these little things getting cuts that won't heal, etc. So how do you take care of your feet, Nurse Bloice? What would you tell your patients?
Well, for me, first you have to actually look at your feet. I think we are not looking at the feet at all. We are too busy doing everything else except actually examining the feet. Even before you put your foot in the shoe, when you're lying on your bed or lounging by the TV, you take a look at the feet, and then even to go further, you get a nice mirror, one that is wide enough, and you could put it flat on the ground and you just look. and it will reflect the bottom of or the sole of your feet. And in doing this, you mightn't see anything today, you might see it tomorrow, but if you continue, you might just see something, because a lot of diabetics don't have pain. They don't feel much pain down there anyway, so they don't realize there's something wrong. Also, the shoes we wear is part of taking care of our feet. We have to treat the feet nice. So just like how we do the fingernails and all that, and we do the toes, we can't forget the type of shoes we wear affects us. So even before we are diabetic, because Dr. Phipps is talking about preventative care, we should pay attention to the type of shoes we wear. So if you pay attention, you shouldn't be too tight in any way. You shouldn't be uncomfortable. That means it's not the shoe for you at that point. No matter where you're going, you should be comfortable at all times. That's part of taking care of the feet. We should dry between the feet, because we're already not looking at the feet, but when we go to the shower, we dry everywhere else except between the toes. I think it's like a norm now, but if we really are more vigilant about it, if we really want to do better, we will really bend down and spend some time between the toes. You'll be surprised at what you find between there. You'll be grossed out because you would not believe this is your toe. So cleaning between the toes, actually cleaning, because sometimes there's built up of dead cells right there, and actually just massaging the toes and the whole feet on a whole. If you don't have any cream, you could use Vaseline, and just feeling them, just to see if there's anything left back in there. Some people have splinters in there for days and weeks and months, until they just have to come to the emergency room and report that they have a pain for 6 months now in the bottom of their foot. You know, yeah, we get those. So taking care of the feet is not just looking at them, they are actually feeling, touching. Be careful of the types of water. If you're going to do a foot soak, you have to make sure that it's not too hot, because as a diabetic, you have to, even before being a diabetic, you check the water levels or temperature, with the elbow, you know, and that should tell you if it's okay. If it's too hot, you will not be able to put your foot in there and survive. We have had people who have had amputations because they choose to soak their feet in Epsom salts. We are moving away from things we don't understand. Back in the day, it was all good to use these products before you ask a professional for advice. But in 2020, we don't want to do things like that. We want to pay attention, and we don't want to try anything. This is not an experiment. A lot of people are trying things out, trying out even new products on the feet without consulting with somebody first, and you might already be diabetic and not aware. So, because doctor is speaking to preventative, many people are walking around as sugar heads indeed. They don't know they are diabetic, so they are doing things and trying out things. By the time they get to the A&E department, if they don't see a private doctor, at that point they're already infected. So, not trying out new things is the way to go. And if you need to, ask a question to somebody who might guide you properly. And you also have to pay attention to, you know, when you're just there and you're sitting, sometimes something look off. It might be a discoloration in the feet. It might not be painful. Things like that could be a sign of something more, even more than diabetes. So paying attention to the feet, please, is of the utmost importance at this point. The tightness of the shoes, you have to be careful of the type of shoes you wear, and making sure you're clean between those toes and drying them out. That's part of looking in the mirror, and even asking someone to examine them for you periodically. If you're a diabetic already, you can come and ask any doctor to just come to check the feet, because it's important that we know that feet are important. They carry us everywhere we need to go, so we want to take care of them. Just like how we take care of the hands and we put on the nice watches and bangles, so we can take care of the feet by even visiting a doctor just to check, or the health center, just to check, have a checkup on the feet. Nothing is wrong with that. You can have that twice a year, just to be vigilant about it. So I think that's what I would tell tell my clients and my patients to do, to care for their feet.
Nurse Bloice, you are so right. And as Bob Marley said in one of his songs, you know, my feet is my only carriage. And that is so true. So we really have to protect our feet. And something you mentioned about the shoe. As a diabetic, you cannot wear these fancy kick and stabs. Females, you know, I don't want to say you have to forget about fashion, but you have to be a lot more vigilant and you have to be a lot more cautious in what you wear. You cannot wear the fancy shoes, and your shoe should be at least a half size up. Because what we don't want is your foot rubbing on the inside and you don't realize. What you have to remember, as a diabetic, you would have lost the ability to feel. That sensation has gone. So if you want to have very nice small Cinderella shoes because you want to look good for the ball, that's not for you. That is not for you. They have so many diabetic shoes you can find online on Amazon. Some of them are very nice. I must admit, some not too pretty, but at the end of the day is to save your foot. It's not about fashion. It's about having your feet so you can go to work, so you can make your money, so you can pay your mortgage, so you can keep your child in school. We have to look at the bigger picture. So try and get your shoe a half size up. Go online or consult with us. I have many sites I go to get diabetic shoes. Nurse Bloice, you have our young doctor here. Get in touch with us. Let us show you where to go to get these shoes. Also, for the person who cannot dry properly between their toes, I normally tell my patients, look, if you have a fan, put the fan on and just spread your toes. Let the air get between, because when you do not dry properly between your toes, you get what is known as fungus. Diabetics get fungus very easily. Once you get a fungus there, it cracks, the area gets dry afterwards, it cracks, that fungus gets under the skin, and from there we get an infection. So these are things you have to be aware of. And another thing, please, if you're going to soak your feet, which we sometimes try not to, get someone else feel it for you. Because even though you may use your elbow, as you would say, Nurse Bloice, sometimes you would have nerve damage, even up in your hands, in your elbow, and you cannot tell whether the water is too hot or not. I have had patients who had 2nd and 3rd degree burns because they were not aware that the water that they were putting their feet in was so hot. So get someone, and please don't get somebody who's a diabetic to feel the water for you. You have to get somebody who is not diabetic to feel the water for you, so he or she can let you know whether it is the correct temperature. Okay? So we have to take care of our feet, and it's just, we take these things lightly, but it is something very serious. If we continue down the trend we are going, in the near future, we're going to have so many feetless people walking around. Well, not walking around. No, yeah, me walking around. We're going to have so many feetless persons in society, in wheelchairs, shut-ins. This is going to put a burden not just on the hospital resources, but the overall GDP of the country. So this thing is wider. It is bigger than me. It is bigger than Nurse Bloice, than Dr. Phipps, and Brother Burnell. That is why we are here. We are here to educate you. And I know we have been out week after week, month, every November we come. And what is still sad, we are getting persons coming to the A&E department septic. Septic, which means the infection is so bad, it has gotten into their blood. And the only thing left for us to do is to rush them to the OR and take that limb off. It amazes me that an amputation in today's age, 2020, has become an emergency for some persons. And we do get a lot of flack for it, because I hear the comments, oh, all they're doing at JNF is just cutting off feet. That is not the case. We are trying. We are here. I have told a patient of mine, whenever who's diabetic, whenever you have a problem, just show up at my office. You don't need an appointment. You don't have to pay me. That gentleman ended up coming to me late, and I had to do amputations on him. So Brother Burnell explained to me, what is the problem? I don't know. Why we cannot get our diabetics coming in with just a little red spot? Why are we getting our diabetics with severe infections that then ends up in amputation? Can you help me to understand? Because I'm tired now.
I don't think I can put my hands exactly. Sometimes what it is, as we would say in local terms, some folks, they just don't like going to the doctor, or they're afraid of. maybe the diagnosis that yes, you're diabetic, and they would take it as, some folks are used to take diabetes as a life sentence. You after you've been diagnosed with diabetes, that life comes to an end. But I want to say to us that it does not. I mean, as our doctor would have said, that once you see it, report it. Take action. Take action. I mean, I'm a living testimony that the doctors, or my good doctor here, does not just amputate. I'm a testimony that when I was admitted to the hospital, Dr. Woodley would have done a wonderful job in terms of trying to save it, but like she said, it was far gone. I think I own up to it. I own up to it because the lifestyle up until then used to be just erratic, and you don't take the time out to look at yourself properly. Nurse Bloice would have given us some advice in terms of, the way you take care of your feet. And so, if I can say anything, or if you can hear anything from me tonight as a diabetic, you don't have to wait until when it's too late to show up and take care of yourself.
Remember correctly, you came to the emergency room for your feet. I don't think it was his hand at first. It was your feet.
Well,
it was your feet,
Actually, I don't know if you remember Nurse Bloice and Dr. Woodley, that I also have an amputation of my toes.
Yes, you came to with your feet.
Yes.
And then I think you looked up.
Yeah, because it was his feet, and eventually you had a cut. And the thing is, you asked him, why is this happening? This is happening because sometimes people only reach to the emergency room or to the doctor when they have pain. Even though they have seen the redness or the discoloration, whether it's red, green, orange, pink, or blue, because it can be all those colors when the infection, when the skin is broken. And
it is a nightmare.
Yes, it's a nightmare. It can be a real rainbow going on in there. But sometimes because there's absence of pain for a period of time, eventually you'll have pain. People don't rush like it's an emergency, and I think that's one of the reasons why people come so late, because they don't really have pain as yet, so they go about their normal business and just, avoid it, or, okay, maybe bothering them, it's maybe some discomfort here and there, but they don't have pain to the point that it brings them to the attention of anyone.
But, Sister Bloice, so where does the family come in? Because, yes, I understand, because remember, we have to look at this now, not just from a patient point of view. Patients live with people. Unless you drop out the sky, you have to live with or around people. So where do we come in as a community, a family?
Everybody have 4 jobs. And I'm probably, you think I'm exaggerating, but outside of the children, even the children have jobs. Everybody is working extra to do whatever. And because everybody is so busy, they don't eat anymore together, so they don't cook. There's no pot food anymore. Nobody's eating from the pot, so they don't have that togetherness anymore. And even in the same house, everybody messaging you in the house. You get in a WhatsApp, say bring something from the fridge, so everybody is so busy in their own world. You don't have that structure, community, family togetherness anymore. I am so guilty of that right now, being busy, so I am thinking of ways to reignite that togetherness with my little family. And a family don't necessarily have to mean like when we're having Christmas reunions and stuff like that. It could be just you and as a single mother, you and your children or whatever. But because that structure is broken down, because people have to work so many other jobs to make ends meet, or long hours at their job, the structure is broken down, so things are missed. If you had that togetherness, things would be highlighted. You would say, what happened to your hand? They look ready. But if nobody there to see you, because everybody in their own world, and people eating in the bedroom now, nobody going by the table. If you go by the table, it's Christmas. They are the only day eating together. Yeah, so we should have Christmas days a lot in the years. Like every other month is Christmas, because that's the only time people try and fight to get home and all of these things. So the family structure is broken down because people are more busy than ever, and it's not necessarily a good thing. So things are missed, and pain, absence of pain, makes people feel, okay, ain't bother Mr. Main coming. So by the time they come, septicemia is on board.
So, Dr. Phipps, your input on this?
I think I do agree with what you're saying, Nurse Bloice, but I also have to say, I think some of the times patients, and that's why this is a really, really good initiative, patients tend to trivialize what they see, because sometimes it starts with a small boil. A small boil, and you don't really give it much concern. It will go away. As you say, you soak it in the Epsom salt if it starts bothering you a little bit. But then, because, and I say this because quite recently, I think maybe 2 months ago, I got a phone call, from a friend from Nevis, and he was telling me, before I was telling him, your father looks like he could be a diabetic. He was losing weight. He was just, based on the things that he was telling me, and were following his P and stuff like that. I was like, you should check it out. They live, I kid you not, they live 5 minutes away from a health center. And he called me and he told me, you know, his father had to go to the hospital and he ended up having to get an amputation. I think it was the last straw. I said, how did it get this far? How is it that there wasn't anything that we could have done? Or, well, we could do things before, but how is it that we didn't prevent that, right? And he was like, all along, I was telling him to go, but he's one of those not so modern age fathers. Like he just work it out, and he's a construction worker too, so he just lets it go off, you know. And one of the things that I told him is that I can't believe that it got to this point. I mean, I'm not that close to the family, but I gave little warning signs. I showed, hey, this could have been prevented. We should have done this. Take your father to the hospital. And then one of the things that happened when I spoke to the sister, I said, did nobody realize this? Nobody realized that his foot was hurting or whatever? And she said, you know, we saw it, but we didn't really pay too much attention to it. So not only did the patient see it, but the family also did. And they didn't pay it any mind. They just figured, okay, let's just take it down. Let's just see, follow up. Went down to the health center. Glucose was sky high, had to go straight to the hospital. When you already controlled that, had to go straight to surgery the next day. And it's like, that is why, and that's why, Dr. Woodley, I said yes with, even though I'm not very good at public speaking, but I said yes wholeheartedly off the bat. Because we don't have a culture of medicine here in St. Kitts. And if I can be an instrument to help to spread that awareness, wholeheartedly I'll be here. I will do that 110%. Because patients need to know. Patients need to know what to do. Patients need to know what they have, what to do, how to prevent it, how to cure it if they're already at that stage, and how to live with it afterwards if it gets to the point of amputation, for example. And so yeah, Nurse Bloice, even though sometimes the family structure isn't as it was once before, I think as an individual, you should know the signs, and if not, your mom, your dad, your sister, your brother. And it's very important, as you said, with the foot care and checking up at the hospital and stuff like that, because sometimes you don't feel like you actually have anything, but just checking in the hospital. Let me just go for a doctor's appointment, because you know, once you have any kind of risk factors, whether your mother is a diabetic, your father is a diabetic, you're actually supposed to go and check up at the doctor ever so often, let's say twice a year, even if you don't have anything, because you have risk factors that predispose you to getting diabetes. So my thing is,
and Dr. Woodley did say that the onset is slow. Well, you said it first.
Yes, the onset is
slow. And because it's slow, it's because something happens that brings you to the emergency room.
And usually, you know, it's never, a lot of the times, you know, the signs and symptoms, you start drinking lots of water, you start peeing fast, you start losing weight, you feel like you're eating a lot more, you start having blurry vision and stuff like that. Sometimes they don't even come for that. You know, sometimes they come for a centipede bite. And you just check their sugar and it's sky high. And you're like, how are you walking around with this sugar?
Yes.
You never realized that you were drinking water too fast? Oh yeah, but I figured, because the place hot. Or you never realized that you were peeing very often. And you'd be like, yeah, I figured it's because I was drinking a lot of water. So, they don't really
justify
yes, they always justify it. So not necessarily they come in for the symptoms or any of the signs, but for some other reason. And I think that's the best thing that we could do. Take all their signs and their vitals, and with that, you get to discover some of the newly diabetics in St. Kitts.
So what I'm hearing here is that the patients have to take some more responsibility.
Yes.
I think that's what it comes down to. I think we are living in a society where sometimes we feel so entitled that even with our own health, we throw that responsibility on somebody else, on the doctor. I have patients who would meet me in town and say to me, Doctor, would you make an appointment for me at your office? I said, but wait, not even that you want to do? This is what is going on. I said, you didn't want to make your own appointment? So this is how lazy and irresponsible we have become in taking care of our own health. It amazes me each time a patient tells me that. Or they would WhatsApp me, send me a whole long message, 12 o'clock in the night, to make an appointment for them at my office. No. We have to take our health more serious. We have to take the bulls by the horn. We have children to live for. We have things to do. Life can be sweet without the sugar. We have to learn to enjoy life. And when, for example, I had forgotten that Brother Burnell, he had amputations of his lower limb, toes.
Yes.
And when we continue cutting and cutting and cutting, the quality of life is decreasing and decreasing and decreasing. So we do not want to get to that stage. And as Dr. Phipps was saying, sometimes the signs and symptoms are hitting us in the face, but we're always trying to justify it. We're always trying to throw it off on something else. And we seem to not want to be living in reality. We are afraid. But I always say to my patients, come to me early with your fright than to come to me late with your fright. Any which way you're going to be frightened, but just come to me early with and be afraid. Come to me early and you're afraid and we deal with it. And we stop whatever. But if you come to me late and you are still frightened and then you lose a toe or you lose an arm or you lose a leg, it doesn't make sense.
Or you become impotent.
And that's another nightmare.
Yes.
A lot of men reach to my office and they invent some type of reason for corruption. But they want to speak to me about the impotence because they cannot get an erection. And it is so true. Men who are diabetic have problems with, or they have erectile dysfunction. They cannot get an erection. They cannot perform. And they are afraid. So they come to the office and they have some strange type of symptoms. And eventually we get to that. This is 2020. We need to get away from that. One of the things Dr. Phipps didn't mention, when I went to Cuba, sickness wasn't tabooed. And when you don't put taboo to sicknesses, you're more open with your doctor. You are like an open book, and that doctor can treat you better. I find here in St. Kitts, everything is a secret. Everything is a CIA type of, clandestine operation. Everybody gets sick. What is to hide about sickness? Everyone gets sick. So we cannot point a finger or laugh because somewhere down the line, we are going to get something. The only how you are exempted from sickness if you are 6 feet. And a sickness took you to 6 feet. Okay? So this is this thing, we have to break out of this shell of hiding. I used to be amazed when I was in school at Cuba, and they would just come and let you know what they have. Oh, I have this, I have that, and I'd be like, how are you telling me that? But nothing is taboo. So these people understand the disease process, what they should take, they would ask questions, and knowledge is power. Knowledge is half the battle. And Dr. Phipps, you mentioned something very important about the signs and symptoms. You said he peed or he urinated and ants was following it. That is interesting because many persons find out they're diabetic just by that. So on that thought, we're going to take a break and we're going to come back and we'll be wrapping up shortly.
Bank Visa debit card 5 times or more weekly for a chance to win a $500 shopping spree. Compliments of National Bank. So think twice the next time you want to use cash. Choose your National Bank Visa debit card instead, because you might be the next lucky winner.
What's going on? Tony Frederick! You've just won National Bank's cashless SKN $500 weekly shopping sweepstakes.
Use your National Bank Visa debit card every transaction for a chance to be the next lucky winner.
I've just never won anything before in my life.
Cashless SKN is our new lifestyle choice. National Bank, always here.
Always here.
Dr. Blake's General Dentistry and Orthodontics, located on South Independence Square Street in Basse-Terre, is the place to discover that perfect smile you have always dreamt of. With convenient hours to serve you, Dr. Blake's Dental assures the best preventative and restorative care to guarantee the health and beauty of your smile. Call 466-7622 for your appointments.
Okay, welcome back to Healthwise. This is a program put on by the St. Kitts Nevis Medical and Dental Association. And tonight we are dealing with the nightmares of sugar in our beautiful sugar city. And we have spoken at length about some of the nightmares, which are hypertension, yes, strokes, blindness, kidney failure, amputations, and impotence, having erectile dysfunction, especially, well, in men. We're going to look at ways to prevent kidney disease, because this is a problem. Kidney disease in diabetics. When your sugar is high for too long, it actually damages the micro or the small blood vessels in your kidneys, and this leads to kidney damage. This then leads to you going to the hospital to go on the dialysis machine. And we don't have enough for everybody. Persons now have to take a line. And if you cannot urinate because your kidneys are bad, that means you have to go to the dialysis department at least 3 times a week. This is killing the insurances. This is killing whatever little money you would have saved up. So prevention, as Dr. Phipps, we studied in Cuba, and primary health care is the mantra. We see the effectiveness of primary health care and how it stops diseases. So there are certain things you can do as a diabetic to prevent kidney disease. And Dr. Phipps is going to speak shortly or briefly about these.
So, as Dr. Woodley said, while you have diabetes, one of the chronic complications that comes about is
we call
kidney.
it nightmare. One of the nightmares.
One of the nightmares that happens is kidney failure. I like to tell my patients it's something like this. You know, when you're making lemonade and you're passing the lemonade through a strainer or a sieve so that you can not pass the pulp and the seeds and all this thing, so you can have the nice pure lemonade. I like to tell my patients that is pretty much how your kidneys work. So after a while, when you have so much sugar passing through, what happens is that it starts destroying the sieve itself. It starts destroying the strainer. So instead of it preventing the seeds and the pulp from passing through, after a while, sugar and protein and stuff like that start passing through. So it starts poking little holes in it. And you don't really want that, because that leads to kidney failure at the end of the day. And your legs start swelling up, your heart starts failing, and all these different complications from that nightmare. And some of the things that you can do, you drink more water, you try to stay away from your red meat. Red meat have lots of protein in it, destroying your kidneys once again. You try as much as possible not to smoke, not to drink. Try to keep your sugar levels in the normal range. Try to check on your pressure very often. Consult your dietitian so you can know what to eat, what not to eat, that kind of thing. As I said before, get busy exercising, increase your activity, and of course, take your medication. Take your diabetes medication, take your hypertension medication, take all these things so that you could prevent or keep kidney failure at bay. All right?
Thank you so much. Can I get the numbers again for persons who want to call in? The numbers are there at the bottom of your screen: 466-2666, 869-662-8674, 767-4765, and the overseas line is 1239-645-4500. Dr. Phipps, thank you so much. Another thing that we are seeing, another nightmare that we are seeing with too much sugar in your body is blindness. And too often our patients end up blind. And that's because we are just concentrating on the foot. I think we have given so much attention to the feet, that we forget that the high blood sugar affects the whole body, the whole economy of the body. It affects everything. So we forget the eyes. And we have persons by the age of 45, 50, I mean, that's me just now, blind because of diabetes. Because we didn't realize, we forgot that we need to have them see the ophthalmologist or the eye doctor. So there are certain things we can do, or if you don't know, just go and visit your doctor. When you go to your doctor, you have to let your doctor know, I need to get my eyes checked. So we have a slide here with some things we can do for good eye care as a diabetic. That will be slide 16. And we're going to have Nurse Bloice just speak about it briefly again. But the point I want you to take home is that you have to check your eyes as a diabetic. Do not wait until the vision gets too blurry or you cannot see anybody to go and get your eyes checked. So Nurse Bloice, you can just run through these for us quickly.
Well, part of the treating diabetes or managing it or living with it is to check your eyes. And you want to make sure that when you go out with us in the sun, you wear protective wear, eye glasses or eye shades that helps protect you from the sun. Make checking your eyes part of your healthy routine, at least the beginning of each year. Have your eyes checked, and if there's any problem, you probably will have to follow up during that same year. Also, you want to make sure as a diabetic you avoid, for those who are high in fashion, the eyelashes and all those added stuff and chemicals that we put on the eyelids that are right there, especially in carnival time. We have those fancy glitter dust and stuff like that. Those can and do become hazards. Some diabetics too, they realize they have problems, but they chump it up to it's nothing.
Nurse Bloice, stick up in there. We have a call. Caller, you're on the air. Good night.
Hi, good night, Dr. Woodley. Good night, Nurse Bloice and Dr. Phipps.
Hi, good night. I'm Brother Burnell.
I'm Brother Burnell. My apologies, sir. I think you're dealing with a very relevant topic, given that non-communicable diseases are on the rise across the Caribbean, and all the nightmares that are associated with diabetes that we tend to forget. But in talking about what we can do, I feel like case management from a primary care perspective could be real helpful for these individuals, because it takes a lot to understand everything that's going on with you and put the pieces together to get the best outcome. So I don't know if there's a role somewhere in the nursing fraternity, Nurse Bloice, that we could start thinking about case management for these individuals and their families to help to guide them to more successful outcomes.
Thank you. Thank you so much, caller. Greatly appreciated. So, Nurse Bloice? We have another caller. Okay, we missed that call. Okay, hi caller, you're on the air. Good night.
Hello.
Hi, good night.
Yes, I'm calling because I want to know how this diabetic system go, because what happened, you find a lot of people, like when they have diabetic, they lose like toe, one of the feet, something. I want to know how it really comes from and how it really affects the body of the feet going down. And after what it come up like from the foot, come up to the knee, and after all it comes straight up like to the pelvic area. So I would really like to know how that come from, like what it is. I know it's starch and stuff like this, but why it affect the feet, you know, first, before any other part of the body.
Can I get slide number 13, please? So the caller can see that. So slide number 13, we're speaking here about the diabetic foot. And you get a diabetic foot. First of all, you have to be a diabetic for you to be considered having a diabetic foot. So in the diabetic foot, what do we have? We have nerve damage. And then we have damage to the blood vessels. So the two things are happening here. Your nerve in your feet become damaged. So when this happens, and the damage comes about because of the high blood sugar in your system, that would cause the nerve to disintegrate. Once you don't have nerves, then you won't be able to feel properly. So you have numbness. Now, if you have a cut, you don't know that you have a cut. So that cut is open. One of the jobs of your skin is to prevent bacteria from entering. So once that skin is broken, bacteria will enter. Now, if your foot is numb and you don't feel that, that cut stays open for longer periods because you will not go to the health center or your doctor to get it checked out. So once that happens, now that infection is there and it gets worse and it gets worse, and it can lead to what is known as gangrene, where your foot turns black. Now, the other problem with the diabetic foot is that you have damage to your blood vessels. So now the blood vessels are super important. The blood takes nutrients, it takes oxygen, it takes all the necessary things that you need for your cells to survive. Now, the blood vessels in the diabetic patient, the blood vessels are damaged. So what does that mean? No blood gets down, especially to your toes, which is further away from your hand. For example, if you have a reservoir, say up at Monkey Hill, and the water has to trickle down in pipes down to, say, the Bay Road, the pipes at the Bay Road will get the least amount of blood because the reservoir is all the way up at Monkey Hill. So that's the same thing that happens in your feet. Your heart is in your chest, and the pipes, which are the blood vessels, they go all the way to your feet. So there's little blood. The blood is less going to your feet. Now, as a diabetic, those same blood vessels, which are much finer, or far away from the pump, they get damaged. That is why when you are diabetic, your feet, your extremities are the ones that are affected first. So what we have, nerve damage, we have blood vessel damage. Now these two combined are nightmares. You can feel when you have a cut. Then secondly, the blood is not getting to the cut area, so you don't have your white blood cells there to go in and clean up the bacteria. You don't have all the nutrients there to heal the wound. So when you have a wound that does not heal, what happens? The infection continues. So the infection goes from the skin, it then goes to the tissues under the skin, then it goes to the muscle, then it goes to the bones, and then you have amputation, or your foot, as we would say, get cut off. So that is why your feet get damaged first, because the blood vessels going down to your feet are far away from your pump, which is your heart. The blood vessels are much finer as well, and they get damaged. Now, we cannot forget the upper extremities, like our friend here, Brother Burnell. As I said, we concentrate so much on the lower extremity, which is, the feet, the leg, and the thigh, that we forget the upper extremities. But caller, I want to underscore here, let us not get to that. Let us not get to amputation. Let us do as what Dr. Phipps and Nurse Bloice and Brother Burnell has said. Let us try to prevent it. Check your doctor. You need to see your doctor regularly, every 6 months, every year. Have your family members, if you cannot see properly, have your family members check your feet. We have so many health centers, and I have to admit, Ministry of Health, the individual doctors, the hospitals, we all trying. I think everybody lives close to a doctor, or everybody knows a doctor or a nurse or somebody who works in the health system that can give some advice. So I really don't think in 2020 we have a reason so much why these things are happening. So caller, let us do the preventative measures. Prevention is better than cure. That's our mantra. We came from Cuba. That's where we studied. Primary health care, as the first caller said, is pivotal. It's super important to take that burden off of tertiary and secondary health care. So we have to, yes, primary health care is not just a job of the Ministry of Health or the doctors. Primary health care is going by grandma on the weekend and say, as Nurse Bloice said, what is happening to your toe? That's primary health care. Let's sit down. Let's just don't wait until Christmas to sit together and realize grandma has a toe over the other and under that it is black. Just don't drop off the groceries on a Saturday by your mother. Go in, look at your foot, see what's going on. That's primary health care. So sometimes when we think of primary health care, we think it's bigger than us, and it's for the Ministry of Health, and it's for the doctors and the nurses. We all can be part of primary health care. Looking. All we need is our eyesight, look. And sometimes we need our hands, the tactile part, touch, to see what is going on. Okay? So caller, we want to emphasize prevention. I know, like all disease process, we're going to get to that part. I have to be real. Some persons are going to lose a digit, a foot, a leg, a arm. That's part of the disease process that we call diabetes. That is true. But I still believe we need to try hard or harder to save limbs. I don't find the zest and the zeal to fight. I feel like I am sometimes fighting more than the patient. Sometimes I feel like I'm in a fighting match with Mike Tyson and I get him blows because I end up losing the battle. It's tough. It's taking a toll on us, the healthcare workers. We need the patient and the family members to get on board. Help us. Help us. When we say you need to get this solution, that solution, go online and buy this and buy that. Don't get weary and fed up and say, oh, Dr. Woodley always sending us there to buy this and buy that. Let us try and save the foot, the leg, the toe. And you might say it's only a toe. And there's a myth I want to clear up because we sometimes say, we just cutting our feet. I have family members who come to me and say, Dr. Woodley, take it. Because they don't want to bring the patient every day to the hospital for dressings. So they try to throw the blame and make us the culprits. But I have many family members who say, I can't come every day for dressings. So just take the foot. Let's get on board. Let's get on the bandwagon. Let's try and save some feet. Come on. Try and save some limbs. That's the most I'm asking. I don't want to be in a doctor's-patient relationship and I'm giving 80% and my patient is just giving 20%. That is unfair to me. That is unfair to the health system. That's unfair to the country. It's unfair to the world. So caller, we are doing prevention. Any more callers we have? If not, I'm going to let my panelists just wrap up. We're just going 3 minutes before 10 o'clock. To give a short wrap-up on the topic, the nightmares of sugar in Sugar City. So I'm going to start with my esteemed patient, Brother Burnell, and then Nurse Bloice, and the new faces of medicine in St. Kitts, Dr. Phipps. So Brother Burnell, give up your wrapping up speech.
Okay, it was a pleasure here with the doctors and the nurse. And I want to say to you, as Dr. Woodley would have said, and I would have been testimony to what she would have said, that it's not always doctors just go and cut, because I had the experience and I know what I went through. I know what Dr. Woodley would have done for me prior to amputation. And I want to encourage us out there as diabetics that we pay closer attention to yourself and your condition, and in so doing you would save that limb, you would save that toe, that left feet, and in my case the arms. Again, I encourage you to take care of yourself and help us to fight the nightmare of diabetes.
Thank you so much, Nurse Bloice.
Well, for me, my advice, I advise you to please, let's have that conversation with our family and loved ones. Now, Christmas season is drawing near. Let's come together and ignite conversations about diabetes and let's start eating more from the pot, as I'm now doing. I'm so happy because it's really fun and it's actually enjoyable. So let's eat more from the pot, and let's try and get our neighbors and our closest families and everybody involved in what we are doing. I think conversation is needed, and it's needed to be more often than November when it's World Diabetes time. So let's start the conversations in the home. Take care of yourself, come and check, ask any healthcare professional. Don't necessarily stop everyone in the street, but book appointments if you need to. Take care of yourself, like Brother Burnell said. I think we can do a little more than what we are doing, so our team is ready to help you if you need any help and assistance. Thank you
so much. And Dr. Phipps?
Just to keep it simple, as advised by my best friend tonight, let your food be your medicine, and let your medicine be your food. I like to say that. Exercise regularly. When in doubt, just ask a doctor. I'm very, very much available to any kind of questions. And check in on your doctor twice a year, 3 times a year, depends. Check in on your family. And as Nurse Bloice said, this Christmas season, diabetics, be careful. Everybody be careful. I know you want to eat the rum cake and you want to eat the ice cream and thing, and everybody trying to fight you down with what you can and cannot eat, but we're really trying to look out for you. All these complications, all these nightmares, we're really trying to prevent it. So let us not get to that point, all right? Have a good one.
All right. So I want to thank everyone for coming out here tonight. I'm really grateful. I really appreciate it because I know we're all busy and we all have things to do. I also want to thank you, the audience, for tuning in and listening. I want to also thank the persons who would have called in. And I want to say this conversation is not over. I think it's far from being over. Diabetes, it's plaguing us. It is really, really giving us a hard run for our monies. But I think we can do more, and I think if we work together, we can really reduce the numbers of amputations that we see, not only in the Federation, but throughout the region and internationally. So with that, I want to say have a great week. Stay safe, wash your hands, cover your coughs, 6 feet distancing. Please have a wonderful week. Bye and thank you.